used for cancer can also incite cancer itself, such as breast cancer. So chemotherapy in itself, you might win one battle but create another war.
The second thing is that they are mutagenic, which means they cause mutations, and that's part of the mechanisms by which they bring about the development of cancer. So both radiation and chemotherapy are mutagenic. They cause mutations. The third issue is they are immune suppressive. So the body has various defenses that it uses to try to get on top of cancer. We have built-in mechanisms to try to control the disease, prevent the disease, and here you have treatments that impair the very systems that are necessary in the body to have long-term control of the cancer. And the fourth factor is they have unbelievable side effects in many cases.
I mean, we know that chemotherapy will essentially kill any fast-growing cells in the body. It doesn't discriminate and pick out cancer cells and selectively attack them. That's the worst aspect of chemotherapy. It's going to kill any cell that's fast-growing in the body. So the GI tract, where the lining of the GI tract involves very fast-growing endothelial cells, is going to take a huge hit, resulting in the major GI side effects, as well as the nausea and vomiting that we associate with chemotherapy. And then, of course, there are many drugs that patients have to take to subdue the nausea and vomiting, which involves that much more cost to the system. And some of those drugs have side effects.
They lower white blood counts in many cases. They lower platelets. So white blood cells are a part of the immune system. Platelets are needed for blood clotting. And if you lower platelets too much, you can have bleeding episodes, and people sometimes die from bleeding out due to drops in platelets. You get severe infections due to the drop in white blood count.
You see some of the deaths associated with cancer treatment involve out-of-control infections resulting from the suppression of the immune system by chemotherapy.
You get nausea, you get vomiting, you have loss of appetite, you get weight loss, you get, not only from the cancer do you get cachexia or wasting of the body, but from the radiation and chemotherapy you can get those kinds of treatments.
Patients often tell me that the worst thing that they experience is fatigue, and it's not addressed adequately by the system. I mean, if you're going to give people these drugs because you claim you have nothing else to offer, there has to be a fix for the side effects. And there could be, and there should be, and there isn't.
I think what we need to do when it comes to cancer therapy is be very selective. And by selective, I mean we want to focus on inhibiting or killing cancer cells and at the same time not harm normal cells. And in fact, if we can, even promote normal cells and encourage their health. So this is what we try to do in our practice. We try to select as much as possible agents that will be very selective and will be helpful to the cancer patient to help them control their illness. What I tell patients when they are trying to make a decision as to what kind of conventional treatment they should do, if any, I say they have to focus on three main questions. The first question is, what is my survival value? If I take this treatment, am I likely to live several months longer, several years longer, several days longer, or at all? Am I going to improve my survival chances by taking this treatment as compared to doing nothing? The second question is, what is my quality of life going to be? Am I going to be healthier and happier and feeling better, or am I going to feel worse? And as we know, the severe side effects from radiation and chemotherapy often will have people feeling worse. If there's no improvement in survival value and you're just going to feel worse from quality of life, what's the point of doing the treatment? As I see it, the main treatment is that it's cultural, it's financial, the standard of care. This is how we do it. We don't pay any attention to making people healthy. We pay attention to killing tumors by using these very harsh treatments.
I think the primary reason is the profit motive, where there is a tremendous vested interest in sustaining a system that relies upon drug sales and radiation and surgery that involves billions of dollars each year in medical costs and profits for the healthcare companies as well as the insurance companies. And the result is there is little funding for alternative therapies, for natural therapies, that in many cases can be complete alternatives. In some cases, can be used as adjunct to conventional care and make an extraordinary difference in improving care, ultimately saving the system millions, if not billions of dollars. But the cost analysis is never done. The research is very paltry in alternative therapies. There's been some increased effort in recent years, but it's clearly insufficient. The system, it's not a conspiracy necessarily, but the system operates on its own profit motive, and the individuals caught up in this system, the doctors, the physicians, the nurses, everybody involved in providing care, are not exposed to these ideas sufficiently, and there's just simply no commitment to the thorough research investigation of these approaches, and certainly not to the implementation within medicine. The potential of natural and alternative therapies to enhance the health of cancer patients, to improve their chances for long survival, and to improve their quality of life is really enormous, and almost to a great extent untapped. Because of this monolithic medical system that really has no particular vested interest in pursuing those therapies.
The cancer establishment basically is an emperor with no clothes. There's constant hype about how many advances we're making and how the pharmaceutical companies are doing such great things, when in fact nothing could be further from the truth. Over the past 50 years, there's been virtually no change in death rate in cancer, whereas several other conditions such as heart disease, there has been significant improvement. In my opinion, we're looking in the wrong direction when it comes to treating cancer. The emphasis, in my opinion, needs to be on focusing on the environment, person's toxic exposures, and on lifestyle factors, including nutrition.
There's a tragically minimal commitment to cancer prevention, and a shift to a greater emphasis on prevention would benefit the entire world.
We're in conventional medicine into treatment. We're not into prevention. The problem is once we start having cancer or diagnosed with cancer, the treatments are either burning it or giving chemotherapy and surgery. Yet nobody's talking about the core issues that got us here to begin with. So when I talk to my patients, I explain to them cancer is a systemic issue that we have to address before we even get to it. So number one is lifestyle, diet.
Any treatment needs to start with nutrition, because whatever you put into your body is going to affect how your body is going to handle whatever disease or imbalances there are.
Today, many people are both obese and malnourished at the same time. And it's a very unique form of malnutrition. It's a high-calorie form of malnutrition.
The American diet traditionally is notoriously inadequate in many ways, and I believe it's particularly inadequate in terms of prevention against cancer.
The food substances that we know are bad in relationship to cancer are obviously animal meats because of all the chemicals and products in there, and certainly the animals that have a bad diet themselves, shrimp and shellfish, live off the junk that comes off of the land into the ocean. And those superficial waters have aluminum, arsenic, various chemicals in them, PCBs, so shellfish are bad to consume. Excess alcohol is linked with cancer. Excess alcohol is linked with gastric cancer and a variety of others, partially because of the topical effect on the lining of the stomach, but also because excess alcohol wipes out vitamins and minerals. In those individuals that eat charred foods and foods that are overcooked, especially meats, you're increasing carcinogen risk.
When you char red meat, it can cause esophageal stomach cancer and also speeds up, if you will, the aging process, because it creates a thing called AGEs, advanced glycation end products. So the more natural, the better.
For those people that have preservatives in their foods, there's another significant risk.
Many foods can cause cancer because of the way they're preserved, like salami and processed meats. Remember, cancer is caused not by one cause, but by a web of causes. And we have to identify as many of these contributors to this web as possible. And certainly the nitrates that are found in many foods is one of those factors. I believe that pesticides and insecticides that unfortunately have flooded our food supply also contribute significantly to this web of causation that leads to this epidemic of cancer that we're experiencing today.
We talk about the beneficial foods, organic vegetables, broccoli with indole carbinol, sulforaphane, any of the green leafy vegetables. Soy has genistein, dadazine in it. When we look at garlic, it's a great immune stimulant. When we look at vitamin C, it can help to quadruple killer cells. So there are a variety of good things to have in the diet.
How do you prevent disease and cancer? A healthy lifestyle, and I call it the pillars of health. Leafy green vegetables, organic if possible, fruit as well. Trying to lean towards vegetarianism. It is a medical fact that vegetarians have less cancer and less heart disease. Drinking a minimum of 8 to 10 glasses of pure water a day, and more if you exercise.
One of the best things we can do is hydrate our bodies. And why not hydrate with some very high potency, highly nutritious fluids for our body? Coconut water contains electrolytes and minerals. It's wonderful for the body. And even coconut milk. Of course, it has to be unsweetened, and the less processed, the better. Another food I encourage people to take in regularly is green vegetables. Green chlorophylls, especially the brassica group, otherwise known as cruciferous vegetables. These are the vegetables, and that include things like kale and bok choy and broccoli and cauliflower, Brussels sprouts. These are just phenomenal foods. They contain specific chemicals, they're compounds, phytochemicals inside of the vegetable. One of them is called indole 3-carbinol. The other one is called carbene, and the other one is called sulfonaphanes. Now, these three phytochemicals together work to actually prevent cancer cells from growing. It protects the cells.
For the prevention of cancer and for the treatment of cancer, it's very important to use green vegetables, both in juices and also fruits in moderation too.
What I encourage people to do is first and foremost start juicing green vegetables: cucumber, parsley, celery, bok choy, scallions, mint leaves. Make the green juices delicious. They don't have to be boring. They are natural diuretics. They're oxygenating the body. They're alkalizing the body. This is what the body needs to do to prevent cancer, and if cancer is there, to prevent it from even growing. The other juices I encourage people to do are red juices. And there you can put in a blender all your different berries or add berry concentrates, and you can mix that with your coconut milk or coconut water. And it's not only very hydrating, but again, it's protective. It's protecting every cell in the body. It's anti-inflammatory. Think of all the different berries out there. You have strawberries, blueberries, black cherries, you have pomegranate. There are so many different red berries, a lot of varieties. So when I have people that are prone to cancer or they have cancer, I encourage them to consume a lot of berries. They're basically low glycemic, and they're very protective and very healing to the body.
Now, in terms of diet, we differ from a lot of other doctors in that we don't just have one diet that we use. We have a variety of diets. We have 10 basic diets, ranging from pure raw foods, vegetarian, to diets where we actually allow a fair amount of animal protein. We have 90 variations of the 10 basic diets. And we're very specific in the kinds of diets we prescribe for each patient. Every protocol, every diet is individualized. So we try and assess each patient's metabolism, but there are certain ground rules that can make it simple. First, nobody should be eating white sugar. White sugar has no benefit for anybody. I mean, people have heard this before. Increasing evidence, even from the conventional medical world, is starting to question the safety of the 160 pounds of white sugar the average American takes in each year. And I don't eat any, so somebody's getting my 160 pounds, and I wouldn't want to be that person. You know, 160 pounds of white sugar is like a half a pound every 2 days. It's almost like taking a drug in huge amounts. It overworks the pancreas, does all kinds of negative things.
People just don't realize how harmful the foods that we've been conditioned to eat are to their bodies and how carcinogenic they are. In other words, how much they can cause cancer. And in a nutshell, these foods include soft drinks, alcohol, all of your caffeine-containing products, sugar especially. That's what cancer cells need to grow and multiply.
Cancer can utilize only sugar. It does not metabolize amino acids. It does not metabolize fats. It can only metabolize sugar. But everything that has what we call high glycemic index, which, just to illustrate, sugar has an index of 100. But white bread, white potato, white rice, white pasta has a glycemic index of about 90. In other words, it becomes sugar very quickly. So even if a patient tells me, I don't eat sugar, but then I find out that they eat any of these items, it's just about the same.
When you eat a lot of white sugar, you're stimulating your pancreas to produce extra insulin. Well, insulin normally drives blood sugar into the cells where it can be used to drive the energetics of the cell. However, insulin is also what's technically known as a proliferative factor. That means it stimulates cell division. Well, that's not too good if you've got too much insulin floating around in your body, because cancer cells thrive and take over your body because of proliferation, that is rapid cell division. Insulin feeds that. We now know that insulin-like growth factor, which is related to insulin, can stimulate cancer to grow very quickly and with very deadly effects. So not only does it produce too much insulin in the body on a daily, hourly basis, which is a proliferative factor again, but it also suppresses immune function. John Yudkin in his brilliant work showed 30 years ago that our high intake of white sugar suppresses immune function, which is the last thing you want to do when you're trying to fight off a cancer. So you have this awful situation where insulin, which is produced because of your excessive intake of sugar, stimulates cancer to replicate, and then you're blocking the very systems that can prevent its growth. So it's basically a double whammy.
We measure and monitor cancers by a diagnostic tool called the PET scan. The PET scan is a scan that picks up cancers because they are avid and they like glucose, and we tag a dye to the glucose and image it. We use fluorodeoxyglucose, that is the molecule we inject, and then we image a patient and we see the cancers light up. Therefore, if you starve cancers of sugar, simple glucose, you're not giving them the substrate or the food they need to grow. And a diet aimed at that should be utilized in patients that have cancers, a high family propensity of cancer. And in fact, I think that a low sugar diet should be the diet, and not using sugars in foods, whether it's high fructose corn syrup, which is evil in and of itself, and other sugars.
Consuming high fructose corn syrup like it's going out of style today, and that's also masquerading as a health food when in fact it's skyrocketing our glucoses, and I think many studies are pointing in this direction that this is a very unhealthy food for a number of reasons, including that it causes an imbalance in our glucose insulin system in our bodies.
You avoid white flour, avoid the whites, white sugar, white flour, white bread, white spaghetti. Fruits and vegetables are loaded with vitamins, minerals, trace elements, lots of antioxidants. They're whole foods. They've got lots of good quality fiber. Of course, again, we adjust each diet according to the patient's metabolic needs. Our patient on a raw foods vegetarian diet will have eating 10 pieces of fruit a day. Our meat eaters will go maybe 1 or 2 pieces a day. So there's a lot of variability, but certainly fruits are better than white sugar. Whole grains are better than white flour. Eating organically, we think, is absolutely important. You know, 30 years ago was thought to be a joke. Even new research from the conventional scientific world is starting to show that children, for example, raised on organic food tend to do better in school, have better behavior patterns than children raised with the pesticides. What a surprise, since pesticides are neurotoxins. The way pesticides kill bugs is by poisoning the nervous system. Who wants that in their body? The argument in favor of pesticides is, well, you're only taking in small amounts. Yes, you take in small amounts with each dose, but you're eating 3 to 6 times a day for your lifetime of 70 to 80 years, hopefully. That's a lot of pesticides accumulating in your body, and no one can convince me that taking in a neurotoxin every few hours for the entire life is going to be a good thing, especially since many of these are stored in the fat in our body, and we don't get rid of them too effectively. I read a study about a year ago which showed laboratory animals raised on organic food live longer, healthy, and even get along with each other better than the animals raised on the pesticide-laden food. What a surprise again. When you're taking all these chemicals, it's going to affect even their behavior. So that's, you know, the food should be as clean as possible. So clean food, whole food, no junk food, no synthetic food, as few chemicals as possible in your diet. Secondly, supplementation. Again, in our office, treating cancer, preventing cancer is complicated because each protocol is individualized. However, there are certain rules that can apply to anybody. First, yes, we think vitamins, minerals, trace elements are extremely important. You know, we know that and we use them. Certain nutrients and vitamins have an anti-cancer effect. Selenium is the one that's touted most heavily. Dr. Clark, during the 1990s, did a major epidemiological study where he showed that people who have a greater intake of selenium have significantly reduced cancers, some of the major cancer killers like lung cancer, for example, and there's studies ongoing right now testing the preventive effect of selenium. There's a lot of debate about vitamin E. There are at least eight different forms of vitamin E, and there's a lot of debate about which is the most anti-cancer. In our program, when we're treating patients, we use the succinate salt of alpha tocopherol just because we find it has a particularly powerful anti-cancer effect in treatment. And of course, vitamin C is the perennial favorite, Linus Pauling's favorite vitamin. He proposed 30 years ago that it had an anti-cancer effect. He's been vilified. He was vilified, attacked. He's now deceased for his suggestion that vitamin C has an anti-cancer effect. Now, I don't think it's magical. I don't think tumors are going to melt with high-dose vitamin C, but unquestionably it has an anti-cancer effect.
Most of us don't get enough vitamin C. So I encourage people to take high doses of vitamin C. And there are preparations now where they make vitamin C's not just ascorbic acid, but ascorbyl palmitate, fat-soluble vitamin C's that absorb much more efficiently in the human digestive system. So I keep very high doses of vitamin C. And anyone who takes vitamin C, I encourage them to be on quercetin. Quercetin is a bioflavonoid. It's not only a natural anti-inflammatory and a wonderful antioxidant, but it also helps to keep the vitamin C in the tissues longer. And that's what we want. We want that protective mechanism of vitamin C in our cells.
So there is definitely an anti-cancer effect to C. Now, the nutrients I've mentioned in terms of selenium, vitamin E, vitamin C, these are all what are called antioxidants. Scientists know what that means. It means they squelch free radicals, which are very active biochemical molecules.